Next time, internal carotid and subclavian artery. And you need to draw this diagram that is really cycle, and the heat is absent. One branch should be here, arteria spinalis posterior. I will draw today, but you should remember that in manual one artery is absent. Clear? Well, first diagram for your understanding, and then a diagram which you need to draw next time. You already know that arcus aorta gives brachiocephalic trunk, left common carotid artery, and left subclavian, and brachiocephalic trunk subdivides into right common and right subclavian. Common carotid artery subdivides into external and internal, and that is external, heat is internal. And internal carotid artery, it goes into the canal, carotid canal. This canal goes upward, then makes angle under the 90 degree, and goes into the skull. Look here, that is carotid canal. Heat is apertura externa of carotid canal. This one apertura interna, and then through upper part of foramen lacerum, internal carotid artery goes into cranial cavity and pass laterally from sella turcica. And heat is near of optic canal. It gives first large branch, that is ophthalmic artery, and ophthalmic artery goes together with optic nerve into the orbita and subdivides into terminal branches, and the internal carotid artery goes upward to the base of the brain and subdivides into terminal branches. That is why heat is ophthalmic artery, arteria ophthalmica, which goes into the orbita through optic canal, and internal carotid artery subdivides into arteria cerebri anterior, arteria cerebri media, arteria communicans posterior, and arteria choroidea. I will draw these arteries in a minute in Willis cycle. And ophthalmic artery, arteria ophthalmica, it gives lacrimal branch, arteria lacrimalis, goes to lacrimal gland. Anterior and posterior ciliary artery, arteria ciliaris, anterior and posterior, goes to eyeball. Arteria centralis retina, the same, goes to eyeball and supplies retina. Arteria etmaidalis, anterior and posterior, they supply cells of etmate bone, dura mater in anterior cranial fossa and anterior part of nasal cavity. The same, it gives arteria infratrachearis and supplies skin of forehead. It gives arteria palpebralis, medialis and lateralis and supplies eyelids, and arteria dorsalis nasi. Today you already know that it makes anastomosis with arteria angularis from facial artery. They are branches of arteria ophthalmica. Now, subclavian artery. We already said that on the right side it starts from brachiocephalic trunk, on the left side it starts from arc of aorta, and subclavian artery at the level of external edge of the first rib continues into axillary artery. A subclavian continues into axillary. And subclavian artery has three departments. It is posterior scalenus muscle and anterior scalenus muscle. And from the beginning, and space between these two scalenus muscles, that is spatium interscalenum. That is why Subclavian artery, first department, that is from the beginning to enter into interscalenal space. Second department inside of this space. And last, third department outside from interscalenal space to external edge of the first rib. In first department, before interscalenal space, from subclavian artery start arteria vertebralis. Arteria vertebralis on the neck pass through transverse processes of cervical vertebrae. Do you remember foramen transversarium in transverse processes? And here it is, we have arteria vertebralis. Clear it is? It passes through transverse processes, then joined with opposite artery from opposite side, from here it is the same through transverse processes, and these two arteries, right and left vertebral artery, joined together. They goes through foramen magnum, both vertebral artery goes into the skull, and here it is, they join and forms arteria basilaris. And arteria basilaris subdivides into posterior cerebral artery. In a minute I continue to draw this moment. Second branch from subclavian artery, internal thoracic artery, arteria thoracica interna. This artery goes to anterior mediastinum, and from internal thoracic artery we have 6 anterior intercostal arteries, arteria intercostalis anterior. The same it gives arteria pericardiaca phrenica, goes to pericardium and diaphragm, and terminal branches are arteria muscula phrenica and arteria epigastrica superior. Muscula phrenica goes to diaphragm, and arteria epigastrica superior goes to anterior abdominal wall and supplies rectus abdominal muscle. Next, tyrant cervical trunk, truncus cervicalis. This trunk gives arteria thyroidea inferior. Today you already know arteria thyroidea superior from external carotid artery. And now inferior thyroid artery, arteria thyroidea inferior. The same it gives arteria cervicalis ascendens, supplies muscles of the neck, and arteria suprascapularis. It goes to dorsal surface of scapula and supplies muscles in dorsal surface of shoulder girdle. They are 3 branches in first department before interscalenal space: vertebral, internal thoracic, and thyrocervical trunk. In second department, in interscalenal space, subclavian artery gives 1 branch, 1 artery, that is costa cervical trunk, truncus costa cervicalis. This trunk gives first and second posterior intercostal arteries, arteria intercostalis posterior. Here was anterior intercostal. 6 anterior intercostal arteries start from internal thoracic artery. And from truncus costa cervicalis we have first and second posterior intercostal arteries and deep artery of the neck, that is arteria profunda colli. Deep artery, arteria profunda colli. And last artery, it starts outside from interscalenal space, and name of this artery, that is arteria transversa colli, transverse artery of the neck, arteria transversa colli. This artery supplies muscles of the neck, skin of the neck, and skin of the back. It passes through brachial plexus, brachial nevus plexus on the neck. They are branches of subclavian artery. It is only for your understanding. And now, diagram of arteries of the brain. We already said that 2 vertebral arteries, arteria vertebralis, right and left, goes into the skull through foramen magnum, join together, and forms arteria basilaris. and arteria basilaris subdivides into posterior cerebral arteries, arteria cerebri posterior. What else? Arteria vertebralis gives two arteries which join together and forms arteria spinalis anterior. That is arteria spinalis anterior. Start from both vertebral but join together and forms unpaired artery, arteria spinalis anterior. Then arteria spinalis posterior. It is paired artery, and these three spinal arteries supply spinal cord. What else? Arteria cerebelli inferior posterior goes to cerebellum. Cerebelli inferior posterior. And from arteria basilaris, arteria cerebelli inferior anterior. Cerebelli inferior anterior. The same from arteria basilaris. We have arteria cerebelli superior. And arteria pontis goes to pons. They are branches of vertebral and arteria basilaris. And basilaris subdivides into two cerebral arteries, posterior cerebral artery. Now, internal carotid artery, arteria carotis interna. Internal carotid artery, it continues into arteria cerebri anterior, arteria cerebri anterior, arteria cerebri media, arteria cerebri media, then arteria communicans posterior, arteria communicans posterior, and arteria choroidea. Arteria choroidea. It goes to choroid plexus. And anterior cerebral arteries join together with the help of anterior communicans artery, arteria communicans anterior. And with the help of all of these arteries, we receive villus cycle or circulus arteriosus cerebri. That is cycle of arteries on the base of the brain, which help to supply brain with blood. For example, if problems, for example, thrombosis of left internal carotid artery, in this case, blood goes to arteria cerebri media and goes to anterior cerebral artery through communicans posterior and continues here and here, or through arteria communicans anterior. The same continues to brain. That is very good for blood supply of brain, that we have a cycle or anastomosis between all of these arteries at the base of brain. And this diagram you need to draw. Number 1, internal carotid. Number 2, anterior cerebral. 3, middle cerebral. 4, anterior communicans. 5, posterior communicans artery. 6, choroid artery. Then number 7, arteria vertebralis. Number 8, arteria basilaris. Number 9, arteria spinalis posterior. Number 10, arteria spinalis anterior. 11, arteria cerebelli inferior posterior. 12, arteria cerebelli inferior anterior. All of these branches, arteria pontis, number 13. 14, arteria cerebelli superior. And 15, arteria cerebri posterior. This diagram you will draw next time. Internal carotid and subclavian arteries next time. That is all.